Hi, I'd like to introduce you to the trademark Doctor Supervised Weight Loss Program, which is now available in our clinic. I'm Dr. Strobel, and I'm going to be guiding you through the program today. Congratulations! You have made a decision to change your life, and you have nothing to lose except unwanted pounds and inches. There are no drugs, no HCG, no exercise, no prepackaged foods, and no dieter's remorse. There's many benefits of losing up to 10% of your body weight. Lower cholesterol and blood pressure, more energy, motivation, and confidence, less joint pain, less low back pain. Also, most participants will develop a regular healthy eating habit and lower certain cancer risk as well as reduce risk of heart disease. Other benefits include developing a healthier gallbladder and lowering the risk of heart attack, improving sleep apnea, breathing, and even your sex life. So we want to celebrate every success we have and every pound that is lost. So how does Doctor Supervised Weight Loss Program work anyway? Well, the plan is based on two things: portion-controlled eating and liquid supplementation. So how does Doctor Supervised Weight Loss Plan work? The drops are used regularly to curb the appetite and cravings, also to increase fat burning. The patient will learn to get away from high glycemic foods during the program, as well as be introduced to an intermittent fasting state. The body will get into a ketogenic state, which is a state of rapid fat burning, but not muscle wasting. But what is intermittent fasting? This is just long periods of fasting followed by short periods of eating. The most common scenario is 16-8, where there are 16 hours of fasting, which is usually overnight, followed by 8 hours of feeding. But why? Well, let's get back to something called the glycemic index, because not all carbs are created equal. Carbs are ranked according to how they affect blood glucose level on a scale from 0 to 100, and that is called the glycemic index. Or another way to put it is how quickly does a food get turned into sugar in the body? Certain foods are low on the scale, and they release glucose slow and steady. This is going to be the best choice for patients who have diabetes, prediabetes, insulin resistance, polycystic ovary, and excess body fat. There are also foods that are very high on the scale, and those foods release glucose quickly. Now, these are also important, but mainly for long distance running or intense exercise, or to offset severe hypoglycemia in an emergent situation for diabetic patients. Now notice I did not say patients who have hypoglycemia, because most patients have hypoglycemia because they eat a lot of foods that are high on the glycemic index, and so their blood sugars fluctuate dramatically. That's a different situation. What is a glycemic load? So glycemic index, which we discussed on the prior slide, is only just part of the story. It really doesn't tell you how high your blood sugar can go when you eat the food. Well, the glycemic load takes into account how much glucose the food is going to deliver in a particular portion. So when you're determining which foods are better or which foods are not better to eat, foods that have a glycemic load of less than 10 are considered low glycemic, whereas those with a load over 20 are considered high glycemic. So the faster or the higher the glucose, this also causes a higher spike in insulin. So in a diagram, you can see that a high glycemic load will cause a rapid and high peak in your insulin level, similar to how your blood glucose level goes up. But what's the big deal about insulin? Most people associate insulin with diabetics, but insulin's very important. In healthy patients, insulin is released normally after any type of eating. Some foods cause more insulin to be released than others. Now, food is broken down into three major groups: protein, fat, and carbohydrates. The proteins are broken down further into amino acids, the fats are broken down to fatty acids, and the carbohydrates are broken down to glucose. And this is where we get our micronutrients. So then insulin tells the cells of the body to open up and absorb these nutrients. And once the job is done, insulin falls back to a normal level. So what makes insulin bad then? Well, insulin's very important for regulate absorption, but it also is vital for fat storage. So if insulin is too high too much of the time and too often, this leads to a state of increased fat storage and weight gain. This is where energy balance is very important, because in order to lose weight, fat, energy must be less taken in than it is the energy that comes out. And to gain weight, the energy in must be more than the energy out. And you could substitute the word calories for this. So to lose weight, calories in must be less than calories out, because calories are just a form of measuring energy. So this goes back to metabolism. So remember, energy in must be less than energy out. What would be the purpose of intermittent fasting? One of the big benefits is that intermittent fasting will help reduce overall daily caloric intake by anywhere from 25 to 45%. The body burns calories also, first from glucose, which is a meal, and then later from fat. So during the fasting state, you will have more fat burning. Most programs of intermittent fasting recommend trying to get to about 16 hours of fasting, but that's not an absolute. We can definitely work around that, especially at first when you're getting used to the program. Now, there have been studies also in certain animal models that show that intermittent fasting may increase longevity as well as reduce disease risk. So let's get back to the program. What is the eating plan like? The eating plan is a portion-controlled plan with 3 phases. The first phase is a loading phase. This is the first 2 days of the plan. The next phase is what we call a reduction phase, and this is day 3 to 40. The last phase of the plan is the maintenance phase, and this is started on day 41 and goes until the end of the last bottle of drops. The purpose of this is to maintain your weight loss goals plus or minus about 3 pounds, as most people will notice a daily fluctuation. The DSWL liquid supplementation are 2 types of drops. The drops are used under the tongue for maximum absorption. There are 2 types of mandatory liquid supplements. The first type is in a blue bottle, and it's called the DSWL drops. The second bottle is a pink bottle, and those are raspberry ketone drops. Now, you might notice that on the bottle it also says Dream Drops, so those are commonly, you will see that on the label. These drops are used during the reduction phase to suppress appetite and reduce cravings, to help burn excess fat, and to increase energy without caffeine or stimulants. The pink bottle, or the raspberry ketone drops, are in the maintenance phase. These drops are started on day 41 and helps to continue burning fat. Now, there is a small amount of green tea extract as well as caffeine in these drops. So if you are very sensitive to caffeine, we may need to make some alterations for this, but most patients do very well on both drops. So how do you use the drops? The drops are used 7 drops at a time under the tongue for maximum absorption. You should not eat, drink, brush the teeth, or chew gum 15 minutes before or after using the drops. Administer the drops using a 45-degree angle while looking in the mirror. Hold the drops under the tongue for at least 1 minute and then swish and swallow. The timing is about every 7 hours. So just remember 7 drops every 7 hours and don't miss the drops. Water intake is very important during our program. We recommend a minimum of half your body weight in ounces of water per day. This helps to remove fats and toxins as well as to avoid dehydration and thirst, which sometimes can be interpreted as hunger. So for example, a 200-pound person should drink 100 ounces daily of water, which is about 12.5 cups. Exercise is not really required, so that's great for most people. Strenuous exercise is really not advised. Now, if someone really wants to exercise, only light exercise should be done, like no more than 2 miles of light walking or biking at a normal pace where you can talk comfortably. If a person insists on exercising, you can expect a slightly slower rate of fat loss because you're going to need to increase the protein intake exactly the same as the amount of calories burned. Otherwise, you're going to feel dizzy, weak, and not have good results. The loading phase is the first part of the plan, and this is everyone's favorite because you get to eat as much junk food and calories as you want. Now, you do need to remember to start the blue bottle drops on the first day. This phase only lasts 2 days, so you're going to cram as much junk, fat, and carbs as possible into your body. It's really high carb, high fat, so think your sugary coffee drinks, your donuts, processed foods like hot dogs, hamburgers, fast food, soft drinks, all of those kind of things. Because this is going to set your body up to lose weight fast. The more calories, the better. You're supposed to gain about 3 to 5 pounds during this phase. So if you don't, you did not load properly. The next phase is called the reduction phase, and that starts on the 3rd day. Now you're still going to be on the blue drops, 7 drops every 7 hours, and this is not timed around your eating. You will start portion-controlled meals. Rapid weight loss is usually seen that first week. So everybody usually loses in that first 4 days of reduction the weight that they just put on in the loading phase. Then after that first rapid weight loss, you're going to get down to where you're losing about a half a pound to a pound a day. Now, 70% of the total plan weight loss is achieved in the reduction phase by day 21. So you're going to be doing the whole program about 60 days. The reduction phase is till day 40, but by the 3rd week of the plan, you're going to have lost about 70% of your weight. So that's pretty incredible. Now remember, the reduction phase has 2 meals, lunch and dinner. You're going to fast in the morning. Now diabetics will work with you doing something a little different. Breakfast. Remember, no food for breakfast. You're going to prolong fasting as long as possible, hopefully about 16 hours, except for diabetics on medicines. Unlimited coffee and tea and water too, but coffee and tea just cannot have any sugar, milk, or creamer in it. Now you can use a non-dairy, non-fat creamer, but not soy or almond milk. So I'm not sure how good that would be. I prefer mine to be black coffee or regular tea. You can use stevia or Truvia or xylitol even if you want. So I use stevia stevia, but I have used that for years. So just use whatever non-sugary sweetener you like. Now, the reduction phase involves eating lunch and dinner. Now, the same rules apply for lunch and dinner. You want to start with your lean meat or protein. So this can be fish also, but 4 ounces, 3 to 4 ounces. Now, that's weighed pre-cooking, so pre-cooked weight. Then you're going to want to get in your veggies, 4 ounces of your veggies. Now, this is very important to do it in this order, too, because that is what you're going to require in order to have the proper nutrients to feel good. So you need your protein, you need your micronutrients that are coming from your vegetables. And if you find that you're really hungry, you can load up on leafy greens or iceberg lettuce. And you can add things like tomatoes, red onions, cucumbers, things like that, even some peppers. A low-calorie, low-fat dressing with minimal or no oil is going to be better. Probably vinegar is your best bet. They have tons of different flavors of vinegar. Now, kind of as your dessert, you're going to allow yourself to have fresh fruit, about 4 ounces there too. And you're really going to want to avoid the fruits that are super high in sugar, like the bananas, grapes, and pineapples. So you want to concentrate more on things like apples, pears, oranges, plums, nectarines, the berries, or even a half of a grapefruit. Now, once in a while, not every day, but once in a while, you can have a type of bread called flat out, and it's a flatbread. You can get it different stores. Here in our area, it's available at the Walmart neighborhood market. I've seen it at Albertsons and different places. I think you could get it at the regular Walmart as well. But something like Melba toast once in a while might work. Just one piece though, and they're pretty small. And there is something called a grissini breadstick. Those are those really long, crisp, skinny breadsticks that a lot of times are put in a salad or something. Now with the flatbread, you're not going to want to have a full piece, but you can half those because they're pretty large. They're bigger than a tortilla, and you can wrap a lot of meat and vegetables up in there and make a pretty good lunch or snack even. And just because this is a low-fat, low-carb type way of eating doesn't mean it's a tasteless way of eating. You can use a lot of spices, and you can use things like spicy mustard, jalapenos, peppers, things like that to give your food a little bit more flavor. So what should you expect? Expect to gain 3 to 5 pounds of weight in the loading phase. If you do not gain at least 3 pounds, you are not going to have the results like you need to have. Now, you will lose that weight in the first few days of the reduction phase. But just because you lose it doesn't mean you shouldn't gain it in the first place, because it's that quick weight gain and eating all those fat and carb, it kind of tricks your body into thinking that you need all that fat. And so that's what makes the fat burning so quick in the reduction phase. So after the first week, most patients lose about a half to a whole pound a day. Now, plateaus may occur. So a plateau is going to be where you have not had any weight loss at all for 2 or 3 days. So if this occurs, there is a section in the booklet that is called plateau breakers. The maintenance phase is the last phase, and this starts on day 41. The maintenance phase lasts anywhere from 21 to 30 days until you run out of drops. And these are the pink drops, the raspberry ketone drops. Now, a lot of people may see a 3 to 5 pound weight fluctuation. It'll go up and it'll go down, and it'll go up and down. Don't get concerned if it starts to go up. You just are going to start gradually increasing a little bit more calories as you become hungry. And we really advise that you start with breakfast, either a lean protein for breakfast or protein shake. Still trying to not eat a huge amount of carbohydrates. Now for your lunch portion, you can double your protein intake to about 6 to 8 ounces instead of 3 or 4. And still stay pretty good on your low starch veggies and fruits. Foods to avoid. Alcohol. Alcohol is off limits once you start the reduction phase. You can use it in your first 2 loading phase days. Your high starch veggies like potatoes, corns, and even beans to some extent should be avoided. Super high glycemic fruits like bananas, grapes, and pineapples are a no-no. And high fatty foods like nuts, avocados, sausage, bacon, and dairy foods are out as well. So you might be thinking, why avoid alcohol? Well, one, alcohol is empty calories. There's actually no nutritional content. And in alcohol, or ethanol, this counts for more calories per gram than anything else. There's 7 calories per gram of alcohol. Now, some of you may be thinking, well, there are not any calories in hard liquor like vodka or scotch or something like that. But the body doesn't really realize that. It interprets it as calories. And the body wants to burn alcohol first. So if it's burning the alcohol, then it's not going to burn your food. Then it'll finally start burning your food. Well, it'll never get to burning fat. And so you're not going to have the fat reduction like you will if you stick to the program. But it's really important. If you're going to have alcohol, don't do it in the first 21 days. And if you do decide to choose it in the maintenance phase, choose a red wine or a straight liquor, not a sweet wine, and not a liquor that's flavored with a high sugary mixer. So a mixer is going to need to be sugar-free and fat-free, not juice or tonic. You could use something like a diet soda or seltzer, something like that. Now, a few other suggestions are to use bar soap instead of body wash, to not use a lot of lotions that have a bunch of oil in them, and try to use an oil-free makeup or lotion. Now, these, you might be thinking, my goodness, that's very limiting. You know, just don't overdo it. A little bit will go, because the body absorbs things through the skin too. And when fat goes into the bloodstream, your body doesn't really know if it got it from diet, if it got it from lotion, if it got it from anything else. So we're just trying to limit any other fat so that your body will burn your fat, your body fat. So what do you do after the maintenance phase? So if you need to lose more weight, you do 21 days of the maintenance phase, which are the pink drops, and then start back over with 2 more loading days. If at the end of 21 days of maintenance on the pink drops, you're at your weight goal, then just continue maintenance until you finish off the raspberry ketone drops. Now, once you get off of the plan, an occasional intake of simple carbohydrates will be fine. The best part is to do it within about 30 minutes before or after exercise. That's when your body's going to burn the most efficient simple carbohydrates. Now, you can allow yourself 1 day per week that you can have a guilt-free meal, and you can eat what you want in moderation, but that doesn't mean going all out for every meal and eating until you're just ridiculously full either, or you're going to end up back in the same place you were. So moderation is key. So it all really works together, becoming aware about the need to lose weight and the health benefits it's going to have on you, learning about the plan, making a personal weight loss goal, incorporating intermittent fasting, then following the plan so that you learn proper eating and develop healthy habits, and then you're going to achieve your goal. So what is included? What is the cost of this program? The office visit is applied to insurance with your copay. Now, some patients don't have insurances or may have a high deductible, so we have discounted the office visit to only $50 for those patients. If this is the only thing that we're discussing, the weight loss program and nothing else, then it will be $50. Now, some patients come in and they may be having other symptoms like thyroid issues or hormone problems, fatigue, things like that. There may be a higher office visit in those instances. Labs are also applied to insurance. Again, if there's no insurance or a very high deductible, we can do a very discounted rate for that. Most of the time, routine, straightforward labs. Now, this is if you don't have any labs that were done by your other doctors. The cost for just routine labs is usually less than $100, but if you have problems and we're checking other things like extensive thyroid testing, vitamin levels, hormones, it may be upwards of $150 to $200, but that's still significantly discounted. The kit includes the pink bottle and blue bottle that you're going to need for the whole program, as well as a tape measure, and that's only $350. It's sold for $600 to $800 in a lot of other places. There will be a free digital handbook with instructions available after you've had your visit. You will get a code with a website, and you will have access to that at any time you want. But for those who prefer a printed copy, we do have those available as well for a separate small fee. 3 body composition tests will also be done here in the office. Now, these are a $60 value. These are sold anywhere from $20 to $40 each, but we're doing them for free for the patients doing the program through the office. You will get one at your first visit, which is baseline. You'll get one at 21 days, which is where you have lost the majority of your weight, and then again at 40 days. You can have them more often, but those are the ones that are included. We're also going to take before photos. These are everybody's favorite thing, photos and measurements. These are not going to be publicized. They are not going to be shown to anyone else. They are going to be put in your chart, and they're done digitally, and those are free also. And then at the end, we will be able to give you side-by-side comparisons as well. We are also going to do measurements at the beginning and again at the end. What is body composition? A body composition test divides the total body weight into 3 different components. One is lean muscle weight, so that's the good weight. The second thing is fat. That's not what we want most of our weight to come from. The third is water. Now, water can be in good places and water can be in bad places. We prefer it to be inside of our cells. If it's outside of the cells, then it's mainly swelling or unhealthy water. So that's what we want to avoid. The report that's generated and will be given to you looks like this. It shows several things. Here is the body composition analysis. It has intracellular, extracellular water, followed by dry, lean mass, and even body fat mass. The next thing is muscle fat analysis. This tells you the comparison between the skeletal muscle mass and body fat mass. It even segments the fat distribution into the different extremities, telling you what % of each extremity has the most fat or lean muscle weight, including the trunk. Now, most women carry most of theirs in the trunk. It also will do a trend. So after you've had more than one test, we will be able to see your results and how you are doing. Now, interesting is this basal metabolic rate. This is the number of calories that your body burns doing nothing except existing. So that is, what will you burn doing nothing else? So for this person, their basal metabolic rate is 1,175 calories. That means if this person does not exercise, it takes 1,175 calories for them to just exist. So if they do not exercise and they eat more than 1,175 calories, they are most likely going to gain weight. So that is a very helpful thing. So what's next? You've decided, you're excited, you want to lose weight, you want to lose body fat, more in particular. What do you do next? Well, just call our office, 957-0275, and make an appointment with my PA, Brooke, or with me. Bring a copy or send a copy via fax of any recent labs you may have done elsewhere. That way we don't really need to draw any labs. And make sure you wear comfortable clothing to your first appointment. Women are going to wear shorts and yoga pants or an athletic bra and a t-shirt. Men, shorts and a t-shirt. Now women, we are going to ask you to take your t-shirt off, so wearing an athletic bra is very important because we want to give pictures of the trunk area and back. Those again are private and they're only going to be for your own visualization later and to keep in your chart. So you're excited and you're ready to get going. What do? You're going to want to review the videos, make a plan, and buy the kit. Also, you need to purchase a digital food scale and a digital bathroom scale that you're going to weigh on daily. Weighing daily is the only way for you to know how you're responding to the diet. You're going to want to review your food list on the plan and buy your food a week at a time for that upcoming week. You'll start the drops and the loading phase for 2 days, and don't forget to use those drops or it is not going to work correctly for the loading phase. Then you want to make sure that you write down your starting weight. I would do it on day 1 and day 3 because you need to know that you gained that weight on the loading. Also, you're going to want beginning measurements. Maybe something like the chest and neck, thigh, waist, hips, something like that. Something that you can follow so that you can measure your fat loss. Before photos need to be taken in 3 views: the front, back, and side. Now this again is just for your use only. I'm not going to have you sending them back and forth to me, and we're not posting them anywhere. You're welcome to post them later if you want, but that is up to you. Now we will take before pictures at your visit, and we will do measurements and weight as well, but it's really good for you to be able to check those things throughout the process as well. And then you're going to want to take after photos. I would suggest day 21, day 40, and then at the very end of the maintenance phase, which will be about day 60. And that's all. I appreciate you staying and listening to the video, and I can't wait to hear about your results. Good luck.